So KarMMa-3 is the first Phase III clinical trial evaluating CAR T cells against the standard of care treatments. So in this trial, the patients had received 2 to 4 prior lines of treatments, and they were randomized to receive either ide-cel, the CAR T cells, or a choice of 5 different standard of treatments regimens. So we've seen the data earlier this year with an improvement of the median PFS, 13.3 months, for patients receiving CAR T-cell versus 4.4 months for the patients receiving the standard of care treatments. And what we've done here is a sub-analysis and looking at the efficacy and the safety of the CAR T-cells and the standard of care per lines of treatment. So patients who had received only 2 lines, or 3, or 4. What was interesting is that, as we could expect, the efficacy, so the first message is that the difference that we observe between CAR T-cells and standard of care is observed in all the different prior lines of treatments, but the efficacy seems to be higher in patients with 2 prior lines of treatments as compared to patients with 4 prior lines of treatment. This is a numerical higher response rate, numerical higher median PFS, and interestingly as well, when we look at the rate of infections, it's also numerically lower in patients with 2 prior lines of treatment as opposed to patients with 4 prior lines of treatment. So the message is that it works for all this patient population without difference between those subgroups, but it's also a kind of indication that perhaps the earlier the better.